Learning Phaco Chop. Chopping is today an integral part of techniques for nuclear disassembly. It is quicker, requires less ultrasound energy, and is probably safer than earlier techniques like divide and conquer. It is also the preferred nuclear handling technique when managing difficult situations like eyes with small pupils, posterior polar cataracts, brunescent cataracts, Morgagnian cataracts, and subluxatory lenses, amongst others. Although it has its advantages over other techniques, chopping is definitely trickier to master in the beginning. This is because one needs to get used to working with much higher vacuum, needs to control phaco-dynamics much better, and consequently develop better foot control, as also to develop bimanual skills. Chopping can be of horizontal or vertical type. The horizontal or a peripheral chop means that the chopper is introduced and brought inwards from the edge of the nucleus towards the phaco tip. For this, a blunt tip chopper with sharp inner edges is usually preferred. The vertical or central chop, on the other hand, uses a sharp tip chopper which is introduced directly in front of the phaco tip in the center of the nucleus, and the two are laterally separated. Very often, chopping is a mixture of the two techniques. While learning, one needs to mentally divide the area within the CCC into three almost equal parts. The proximal one-third of the area is used for making a small groove or tunnel. The distal one-third is the area of movement for the chopper, and the middle one-third is for the final hold and separation of fragments. The groove gives the beginner a better sense of direction and depth. Later, once the surgeon feels more comfortable, the groove may be dispensed with and one moves on to a direct hold and chop. If one were to imagine the capsular bag in a cross section, you need to work in the middle one-third at a depth which is more than 50% of the nuclear thickness. The other point to remember is to make sure that the chopper and the phaco tip are in line with each other before separation. If not, a torque will be introduced and the nucleus rotates rather than crack. The golden rules for chopping are that adequate depth is crucial and should be at least more than 50%. One needs to be careful about the CCC margins. Please don't chop the capsule. Also avoid pulling or pushing the nucleus mechanically. Let the tip embed by vacuum and phaco power. Once one half of the nucleus has been removed, you can pull the rest of the nucleus towards the middle of the bag to chop, since now you have space and this will not stress the zonules. Always stay close to the center for most maneuvers. Be slow and watch all that is happening very carefully. An approach angle of about 45 degrees is ideal for most situations while chopping. Towards the end of nuclear disassembly, the bag is now empty, so the angle of approach may get a little more horizontal. Before introducing the phaco tip into the anterior chamber, make sure that the amount of bare tip is adequate for that grade of nucleus, and that the sleeve orientation is with the irrigating ports towards the sides. Plan the placement of incisions. Incisions which are too close to each other or too far apart hamper maneuverability. A 45 to 60 degree angle between the main incision and the side port is ideal in the beginning. Later on, one may modify according to personal preference. When attempting to chop, mentally split the movement into three steps. For step 1, embed the bare part of the phaco tip till the sleeve starts touching the nucleus. For step 2, stop using phaco power and keep the foot switch in high vacuum. Finally, step 3 involves moving the chopper, bringing it close to the phaco tip at the same depth, which is more than 50%, and then separating the two to achieve a crack. This is how a horizontal chop would look like. The phaco tip embeds the nucleus till the sleeve starts touching the nucleus. The blunt tip chopper moves to the edge of the nucleus under the CCC margin, comes in towards the phaco tip, and the two separate before touching to achieve a crack. For a vertical chop, a sharp-tipped chopper is used. Once the phaco tip is well embedded, the chopper is introduced directly into the nucleus in front of the phaco tip, and the two are separated to achieve a crack. The beginner tries to hold the nucleus too peripherally to chop. Always try to hold the nucleus as centrally as possible in order to minimize complications. Do not pull the nucleus when trying to chop. This is important especially during the first few attempts when the bag is full of nucleus and any pull is directly transmitted to the zonules. Once part of the nucleus has been removed, space is created within the bag, and pulling on nuclear fragments does not directly stress the zonules. And don't push the nucleus mechanically. The beginner is having trouble controlling the eye position and is also stressing the capsular bag by pulling on a large nuclear fragment. This situation could easily lead to a complication. The aim is to stay in control of all steps of surgery. Another look at the horizontal chop. The phaco tip embeds the nucleus till the sleeve starts touching the nucleus. The blunt tip chopper moves to the edge of the nucleus under the CCC margin, comes in towards the phaco tip, and the two separate before touching to achieve a crack. To summarize, one must learn chopping. It is the preferred nuclear handling technique for a majority of cataract surgeons today. Work slowly in the beginning and carefully watch every movement. Each movement is a planned, deliberate move which leads to a desired effect. Once you get the hang of chopping, surgery indeed is a joy.